Welcome everyone to Adieu to 2021 Year in Review. Thank you all so much for joining us. Our moderator for today's call is Jill Brooking. She will be answering the questions you send through the Q&A today. We will try our best to answer all of your questions, but if for whatever reason we are unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We will be sharing the recordings in the follow-up email. If there are any portions of this call that you missed, by Friday you will receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'd like to hand over the call to Jill Brooking, Vice President, Benefits Compliance at NFP. Jill, the floor is yours.
Thank you. Hi, everybody. Welcome. This is our annual year-end wrap-up, and this is where we talk about what happened this year, what we see coming ahead in the world of benefits compliance. If you haven't been to one before, this is going to be a casual conversation. No slides. We may post a link to some slides you can look at if you want to. It's more of just an agenda and a takeaway, but this is just designed for us to have an open discussion and for you to see our faces. We are all on camera and this is the entire team today. So I also want you to know that that was Amber post-hour, and she is the one that opens us up every time. So that's her in the corner, and she just is going to share the link, if we can get it to go, in the chat. And I'm going to introduce each team member as we go. So let's kick it off with Patrick Myers, and he's going to talk about the new administration. So Patrick, in some respects, this has been a super long year. We all had hopes that 2021 was going to be different than 2020. It's hard to remember what happened all the way back in January, but we had a new administration this year. So before discussing the orders related to the vaccine mandate, which everyone wants to talk about, what else can you share with us on the new administration, like priorities, orders, legislation?
Thanks, Jill. I think the things that we're going to be discussing today, I'm going to focus my response to this question on a couple of things that happened at the beginning of the year that has some impact on benefits. Specifically, in February was a pretty busy month for the Biden administration. One of the first things they did that month was they issued a memo that declared that regulations that fit certain criteria were to be frozen. That is, some of those rules that were not yet on the Federal Register by that point, as well as some rules that had made it to the register but were not yet final, were going to be pulled from the process and reconsidered by the different agencies that were promulgating them. And the two sets of rules I think that are of most importance or interest to the benefits world was the set of rules that the Trump administration had promulgated at the end of 2020 regarding the independent contractor, specifically the test through which an employer can determine whether or not a worker was an employee or an independent contractor. You may recall that Trump's promulgated rule had a much more generous test for determining whether or not a worker was in fact an independent contractor. But the Biden administration, promptly withdrew that rule, and it is no longer effective, or in fact, before it even became effective. So the current law of the land, the regulation of the land, I should say, are the independent contractor rules that are currently in place, have been in place for a while. And those tests are the original tests are still the tests to use. The second set of rules that are probably even more within our wheelhouse were the wellness program rules that the Trump administration had promulgated at the end of 2020. These rules essentially were focusing on incentives and how to determine what is an appropriate amount for an incentive to participate in wellness programs. And they introduced a de minimis standard for incentives to be handed out as part of a wellness program. Now, again, those rules had actually made it almost to the final stage, and they were withdrawn as well. And we don't really anticipate those particular rules coming back, at least not in that form. Now, I'm not aware of, I've ever heard any rumblings anywhere about any movement to promulgate new rules with new standards for these incentives or wellness programs, although I suspect we may see some probably in the next year or so as the administration begins to focus more on that part of it. But the only other thing I'll mention here at this stage is that the other thing that the Biden administration did in February was the administration withdrew its support for the Republican state's legal challenge to the ACA, which at that time was winding its way up to the Supreme Court to be challenged in the Supreme Court. I think one of my colleagues will be talking about that a little more at length, but that was one of the other more significant things the Biden administration did to essentially unwind what the Trump administration was doing right before they left in 2020.
Yeah, thanks, Patrick. The wellness rules has been a long story, so thank you for that. And independent contractor rules, it does apply in our industry in an indirect way. An employer trying to decide who to offer coverage to and how to comply with the employer mandate, which we've covered in a recent Compliance Corner FAQ.
That's right.
Okay, so let's move on to the hot topic of the vaccine mandates. What is the status of that? And I kind of already know the answer to that. So if not required, can an employer require employees to be vaccinated anyway, like if they wanted to have a voluntary?
Well, as everyone doubtless knows by now, the Biden administration's OSHA division in early November issued an ETS, which is a emergency temporary standard, which would require employers with 100 or more employees to enforce a written policy that would mandate vaccines for all employees. However, the ETS also allows employers to promulgate policies that give employees a choice between getting a vaccine or subjecting themselves to weekly testing. That was almost as soon as that ETS was promulgated, it was challenged in the courts. And it first made its way up to the Fifth Circuit. Actually, I think it's in every federal district. But the first appellate court it met, which was the Fifth Circuit, they put a stay on it. It was a nationwide stay, which meant that the ETS could not be enforced by the federal government until such time as the litigation has wound its way through the courts. Because it was in almost every federal district in the country, it was subsequently consolidated into one appellate court, which is the Sixth Circuit. And the Sixth Circuit has since also upheld that stay. So as of right now, the ETS is not enforced and may not be enforced for quite some time, although it's anyone's guess as to when that will actually be lifted, if it will ever be lifted indeed. So if you are an employer and you're thinking about implementing your own vaccine policy and wondering what you should be doing, a thing that should be seriously considered is perhaps promulgating a policy that behaves much like what is required or mandated under the ETS, which is to say a policy that either mandates a vaccine for everyone or gives them that choice between a vaccine or a weekly test. That way, if the stay is lifted and the ETS becomes enforceable, at least you will be well on your way towards complying with that ETS.
Thanks, Patrick. And I want to say thank you to Beth as well. Yes, feel free to submit some questions in there. I'll be monitoring those. Give me something to do. And some of you submitted questions with your registration that we have incorporated. And one of those, Patrick, was, so if an employer is going to go ahead with their own policy, and as you said, kind of mirror what it would have been or could be, so an employer is going to do a policy and they're going to have weekly testing for those that aren't vaccinated. Can they charge employees for that? Does the employer have to pay for that testing?
The ETS does not require employers to pay for this testing, but that is not to say that there may be other requirements, say on the state level or local level, or even in any sort of collective bargaining agreements between the employer and a union that would require them to pay for that testing. Of course, on the other side, the ETS also does not prohibit that. So if an employer chooses to pay for that testing, they're certainly welcome to do that.
Great, thank you, super helpful. Okie doke, Carol Wood, you're up. This is Carol. Oh, and I want to say, in case you haven't figured it out by now, Patrick is especially skillful at government process, and like the old cartoon, I'm just a bill sitting up on Capitol Hill, and we learned how bill becomes law. Patrick, that comes to him naturally, and a lot of those Washington updates that you receive, he wrote. Okay, Carol, and Carol's background in HSAs, a lot of you that have HSA questions, ultimately they come across Carol's desk. Okay, so Carol, transparency and surprise billing. I think all of us as consumers ourselves, we can understand surprise billing, which some people call balance billing, because of our own personal experience, right? We have scheduled a procedure, we do all we can do, we choose an in-network provider, we choose an in-network hospital, and then afterwards we're sitting at home healing, and we get this bill from a radiologist that we did not select, and they're saying it's out of network and I owe a lot of money. So what can you tell us about the new provisions that will change this surprise billing practice?
Thank you, Jill. And they will address the situation that you're just describing. So under the Consolidated Appropriations Act, No Surprises Act, the surprise billing prohibitions, they're probably one of the most significant provisions that affect plans. Previously, just to backtrack, we had this scheme of state laws to try to protect participants from the situations, Jill just described, the balanced billing situations. But now under the Consolidated Appropriations Act, this really affects all plans. So it applies to insured plans as well as your self-funded plans, which weren't generally affected before, and it includes grandfathered plans. So the idea here is that it will protect participants from surprise medical bills for out-of-network services, including, of course, emergency services, but broadly defined. So it wouldn't just be your screenings, and it would include ancillary services, some stabilization, post-stabilization services, after you're out of the emergency room in the hospital. It includes air ambulance, unfortunately not ground ambulance services, but also the situation that Jill was just describing, certain non-emergency situations where, for example, if you scheduled an elective surgery, a hip replacement at an in-network facility, and lo and behold, the anesthesiologist was out of network, you're protected by these provisions from being balance billed. So how exactly does this work? Well, the participant can't be balance billed, but it also limits the participant's cost sharing to the in-network levels, and it requires that cost sharing to count towards the in-network deductibles and out-of-pocket maximums, which normally isn't the case for out-of-network services. So I guess to give you an example here of how it would work, if a participant, let's say the out-of-network provider builds $15,000, then what would the participant's amount be based upon? Well, let's say the in-network cost sharing was 20%. So the participant's going to be charged 20%, but how do we determine the amount that 20% would be based upon? So the surprise billing prohibitions say, okay, there's sort of a process here. We look first to see if there's an all-payer model agreement. That's only Maryland or Vermont that have those. Those are agreements with CMS. The state has with CMS. An amount determined under a specified state law. So this would generally apply to insured plans where there's a state law that would govern that particular item or service. And if neither of those applies, then it's the lesser of the bill charge, or what's known as the qualifying payment amount. And you're going to probably be hearing more of this particular term, so it's good to remember it, the qualifying payment amount, or QPA, and that's the plan's median contracted rate for that item or service in the geographic region. So for a self-funded plan, it could either be the plan's rate for the item or service, or it could be the rate, there's a choice, it could be the TPA's book of business. So let's just say the QPA in my example was $10,000. So the providers billed $15,000, the QPA is $10,000. There's no state law that would govern. Then the participant would pay 20% of the $10,000 or $2,000. And then the remainder, the $13,000 difference between what the provider billed, now is for the plan to resolve with the provider. So the participant's off the hook. So this is great news for participants. Well, how does the provider and the plan resolve that discrepancy in the amount? Again, we look to see if there's an all-payer model agreement, a specified state law, and then in the absence of that, it's just going to be an amount agreed upon by those two parties. And if they can't agree, if the plan and the provider cannot agree on an amount, it's going to go through this new independent dispute resolution process. So the parties would have to try to negotiate for 30 days. Once that's exhausted, they could invoke this process. And what's interesting about this process is that there was just last week, a legal action was filed by the American Medical Association of Providers contesting a provision of this. So it's going to be interesting to see how it plays out. But the basic idea, or the way in the rules, the independent dispute resolution process would work is that it would presume that QPA, again, the contracted rate, for that item or service in the region, is the appropriate amount. So the idea seemed to be that the provider and the plan would have to, bring their rates in within a range of that QPA, because the entity that was selecting would have to select one of the two amounts that were proposed, either the provider's rate or the plan's rate. But now the AMA is contesting this and saying, well, that was not in the Consolidated Appropriations Act. This presumption that the QPA is correct. There should be other factors that are given equal weight, the experience of for example, the experience of the provider, the challenges of providing services to that particular individual, quality measurements. So this is just in the district court, just filed last week in DC, but I think that's something we're gonna have to follow. For now, we're gonna go with the presumptions that are in the rules, since these take effect, for plan years beginning January of next year.
Thanks, Carol. And I'm hoping you can confirm a question that I just answered. It said, does this apply to dental or medical only?
I don't believe it. It would have to fall into emergency dental services. I don't know if dental, would it be emergency? Would it fall into those categories?
I thought it was medical policies only, which could include sometimes emergency dental is covered under a medical policy, especially if you have to have anesthesia. But I thought it was just medical.
Yeah, I'll have to check that, Jill. That's a great question. So I think we can do a follow-up on that. So
great.
Good question. Thank you.
And so that is just surprise billing. That was just one part of transparency. But the transparency rules go much further than that. Can you highlight briefly just some of those provisions and explain what an employer would need to know or do?
Sure. And just going back to your question, something just came to mind that may help just to answer our dental question just quickly. It applies to emergency rooms and also independent facilities if they've been licensed to provide emergency services. So I'm thinking the dental is not going to fall into that category. So I think that would be the answer to that question.
Thank you.
Yes, there are other protections. There are patient protection provisions that were also part of the No Surprises Act. And these also are taking effect plan years beginning January 1st. We have good faith compliance here. One is continuity of care, where if a contract is terminated with an in-network provider, participants who are undergoing care for serious or complex conditions have the option to elect 90 days of continuing care with the provider under the same terms and conditions. So that would be basically in-network rates. We know the ID cards are being updated. They have to include cost-sharing information on the physical and digital ID cards. There's also provider directory provisions that require the plan to maintain accurate and current records of in-network providers and facilities on a public website. And there are also provisions that are part of that, if a participant inquires as to the network status of a provider and is given incorrect information, they have to be responded to timely, then that they only have to pay the in-network rates. So that's something that you want to be careful about, certainly working with your service providers and making sure your directories are updated. Here's some other provisions that I'll just move to more on the transparency side. And one is not under the Consolidated Appropriations Act, but under the Transparency and Coverage Final Rule. This was passed just prior to the Consolidated Appropriations Act last year, or finalized, I should say. And this requires the public disclosure of pricing data, negotiated rates for in-network services, historical out-of-network bill charges and amounts over a 90-day period. And enforcement was delayed. That commences now on July 1st of next year. The disclosure is in a form of machine-readable files that have to be posted on a public website. It's open for anybody, the general public, to access. So that has been delayed, but those provisions are now being enforced as of July. So that's something to keep in mind. And similarly, under the Consolidated Appropriations Act, there's a required to disclose information on prescription drugs, pharmacy benefit reporting, and plans and carriers are required to report quite a bit of information, some specific to the plan, most on the prescription drugs and the spending under the plan. There were just final rules. In fact, Jill, I believe you wrote these for Compliance Corner, released before Thanksgiving, kind of explaining a little more of the reporting framework on that. It'll be, the anticipation is that the service providers and carriers will do most of the reporting by state and market segment. Enforcement was delayed, but now the 2020-2021 calendar year data needs to be reported by late December 27th of next year. And just quickly, in all of these cases, employers, the bottom line, what do employers need to do? They need to work with their carriers or service providers, make sure their contracts are updated to reflect, who's responsible for the different obligations, plan documents, communications need to be updated, particularly with the surprise billing prohibitions. Don't forget, you need to post a notice. A model notice has been provided on a plan website, and that information should be in each explanation of benefit, explaining the protections for those covered services, and really monitor. I think the plans are going to need to monitor the effect on the plan costs, and also monitor for additional guidance. And we'll certainly be following the court cases and the different guidance and legislation and update you accordingly. So.
Thanks. Yeah, the main takeaway there is rely upon your advisor, your consultant. That's what we're here for. The carriers, even ASOs, administrative services only for those self-insured. The carrier is going to do a lot of this heavy lifting, but you don't want to be caught unexpectedly if, the members come into your office or call you now or text you and say, hey, I got this new ID card in the mail. It looks different. Do we have different insurance? Now you will know that it's just because the cost sharing has to be on the ID card, as an example. Okay, thanks. So now let's move on to Beth Allen, who's going to talk about mental health parity and this elusive comparative analysis. But before, one little tidbit about Beth, and a lot of you may already know this, she was the dreaded DOL investigator / auditor for 5 years.
Dreaded, jeez.
Dreaded, but she always worked with the clients. So Beth, on this topic, first of all, remind us what this comparative analysis, what is this?
All right, so let's back up a little bit. And I kind of love this. I actually love MAPIA, which I'm sure a lot of you hear that and you're like, what? I actually like it. But part of the reason is because I've been following this whole saga since I was at the DOL, right? So remember that MAPIA basically says mental health is health. And so you need to treat mental health treatment basically the same way that you treat medical surgical treatment. That's the goal. If you offer mental health, we want it to be offered in parity with the way that you offer medical surgical coverage. Now, there's a few ways that you're going to do that, right? There's this idea of quantitative treatment limitations or limits that you can count and financial differences. And you don't want those to be any more restrictive than what's applied to mental health, right? Those things, the DOL dealt with insurers on that for like a decade, right? So we're kind of at the end of that. Most of our plans do not have quantitative treatment limitations or financial restrictions that should not be there. But then the DOL started harping on the non-quantitative treatment limitations. And those are things like, requiring for people to have to do pre-authorization before they get mental health treatment, where that's not required on the medical side. Or potentially saying, well, you need to go through these medical management techniques on the mental health side before you're able to, let's say, get some kind of pharmacy benefit that you need for mental health treatment. And so they've really been focusing on that lately. And really what happened is that the DOL was dealing with this with insurers directly, right? Because insurers, for the most part, put these into the document, whether it's to the fully insured side or the self-insured side. The DOL had been dealing with insurers, and insurers kind of finally got to the point where they're like, hey, you don't really have jurisdiction over us, DOL, so we're not going to give you this information, and we're just going to say that we're in parity, and you're going to have to trust us. Well, obviously, the DOL was not good with that. And then in the Consolidated Appropriations Act of 2021, basically, Congress came out and said, well, all of you plans need to now do a report that tells us about the non-quantitative treatment limitations in your plan, and you have to explain basically how they're in parity. And so that's the requirement that we got and kind of what we're looking at.
Thanks, Beth. It is an important topic. I think it's just because they didn't give us a model, it was a little confusing to a lot of people. Okay, so now that we have the background, thank you. Is this going to be more of an issue in 2022? Like there was a small sampling that the DOL requested and participants can always request. And where can we get assistance if, the DOL or a participant comes a knocking?
Yeah, so this was a very interesting one because we got the CAA in December of last year, and they made this requirement effective February 10th of this year. So like 90 days or something. And this was really hard because they, like Jill said, they didn't put out a model. All they said was, we're going to basically ask 20 plans throughout the country for this report sometime in the next year. And Congress did require them to do guidance within 18 months, but they've done nothing. And so the hard thing is that there's now this report that has to be made and nobody has ever seen one or what it's supposed to look like. A lot of the insurers kind of started off very skittish about it, thinking that the DOL was going to put out guidance. They were not. We actually had bets going on. I knew they weren't, right? Because what the DOL is going to do is they're going to wait for these reports to come out. They're going to gather them, and then they're going to come out and say, this is how these are deficient. Okay. And remember that the whole reason why they were willing to do such a quick turnaround on when you had to comply was because of the idea that if you have non-quantitative treatment limitations in your plan already, you should already know that they're in parity, right? Otherwise, they shouldn't even be in the documents. And so what we're going to see going into 2022 is that the DOL is going to be asking people for those. They've already been asking people who have been audited for those reports. I think from the standpoint of the employer, if you're fully insured, it's a little bit easier because pretty much all of the fully insured insurers have created this report at this point, and you just need to make a point to get a copy. So if the DOL or a participant asks you for it, you have it. On the self-funded side, it's a little bit more difficult. And we have some insurers who have said, okay, we have this report if you have our self-funded product and you didn't make any customization and you can use it. Other, self-insured TPAs have said, well, we're not going to make you one, good luck. And that's hard. And obviously we know that's hard on you. And we can't even say necessarily that we have the best solution. I think the biggest thing that employers are going to want to do if you find yourself in that situation is just start talking with the TPA about how you're supposed to go about getting the data to even do these reports and kind of back them into a corner about providing whatever it is that they can provide. And so I think that we're going to see the DOL, once they come out with that guidance, potentially, having some leniency maybe for self-funded plans where they didn't have a lot of choices. But I think in 2022, this is going to continue to blow up.
Thank you. So yes, be prepared, at least be on the lookout if someone mentions this, a participant, and be looking, if the DOL comes. And that's what we're here for. What would you do if you got this request? You would contact your consultant if you didn't know what to do. Okay, thank you very much. And so let's move on to Yoko. Hello, Yoko Yoon.
Hello.
She is the latest member of our team. She has been in New York for NFP for many years, but she has just moved over to our team. Yay! And she is super good at research, and she's also becoming very good and becoming the leave guru. I don't want to build her up too much here, but a preview. She is making a state leave chart for all of you that will detail the requirements for state disability and PFL. So that is coming very soon. Okay, Yoko. ACA status. So under that title, I guess we need to first mention that, hey, guess what? The ACA is still in play. It survived yet another legal challenge, so with the Supreme Court. So tell us about that.
Yeah, thanks, Jill. That's right. So back in earlier June, the Supreme Court released its decision on the latest ACA court case that challenged constitutionality of ACA. So the plaintiffs include Texas and some other states challenge that because the individual mandates penalty is now became $0, so it no longer has a tax authority. So they believe it is unconstitutional. And because individual mandate is unconstitutional, they believe whole entire ACA should be unconstitutional. And the defendants include California, some other states, argue that the plaintiffs could not bring the case to court because they were not harmed by the individual mandate, especially now the penalty was reduced to $0. The Supreme Court decision was they agreed with the defendants, and because the plaintiffs could not show ACA individual mandate harmed them, the court dismissed the case. So as a result, the ACA remains the law of the land, and employers should continue to comply with all ACA provisions, including the upcoming W-2 health cost reporting due the end of January, and ACA forms 1094, 1095 reporting that we're going to touch base a little later. And quickly to go over other ACA changes that took place this year, American Rescue Plan Act of 2021 increased the premium tax credits that are offered at the state's marketplaces and also expanded the eligibility. So more individuals can receive premium tax credit and that will apply for this year and next year. And another update is ACA non-discrimination provision, section 1557. So Trump administration significantly limited the enforcement of section 1557 and eliminated gender identity and sex stereotype under the sex discrimination. But earlier this year, Biden administration began taking steps to restore and expand the provision again, and announced that HHS will enforce Section 1557 prohibition of discrimination on the basis of sex, including discrimination on the basis of sexual orientation and gender identity. So based on that Biden administration's initiative, you as an employer may want to review your plans to make sure that your plan benefits do not discriminate on the basis of sexual orientation or gender identity, especially the possibly include gender dysphoria treatments.
Absolutely. Love that you went into all of that, because that could be a highly litigious area. And I'm glad that you mentioned the status. It's hard to keep up with, all the legal challenges.
Yeah.
I answered a question just this morning. An employee wanted to know if they waived coverage and went without any coverage, would they have to pay a penalty? And so, as you said, the individual mandate penalty, no. Some states have their version. That's why Yoko mentioned the state reporting that's coming up, and that will be in a white paper. But speaking of reporting, there have been some updates there, some practical changes we want to talk about.
Yeah, so for the ACA 1094, 1095 reporting, which is the due date that's coming up with this year's reporting, And to begin with the good news for employers, the deadline for employers to provide Forms 1095-C to employees this year has been postponed to March 2nd, 2022. And there is a proposed rule in work that will make the auto 30-day extension going forward after this year. But at least for this year, for sure, you have 1 extra month to prepare for the forms. On the other hand, not good news for ALE employer is that IRS removed the good faith efforts penalty waiver going forward. So as you may recall, the good faith penalty relief means that if you make a typo or didn't miss 1 or 2 boxes, IRS will remove or overlook the penalty. But now without the good faith penalty relief, employers may want to focus on completing the forms thoroughly and accurately starting this year.
I love that, Yoko. You're bringing the good news and the not so good news.
Yeah, combo.
Yes, thank you so much. That is a little bit of how the last 2 years have been. Okay, let's move on to Diane Cross, who has the unfortunate topic of continued COVID relief. We're so tired of that phrase. A little tidbit about Diane, she is the white paper queen, and she is really great at getting all of those papers. She works with Linda Gall, I'll give her a shout out too, on getting our white papers out to you and written and revised, and keeps those all up to date. So thanks, Diane. You're really good at that. Okay, so what do we need to know about the COVID relief? Are there some end of year requirements? Is anything continuing and will not end?
Yes, excellent question. And I wish I can say there's good news and not so good news. I guess the good news here is that the IRS and agencies have responded, and a lot of the intent here is to provide some relief for individuals. So I guess that's the good news. But first, before I get into answering that question, just a friendly reminder that there's been such a good deal of guidance related to COVID-19 and benefit plans. So I would strongly recommend reviewing our Get Wise Wednesday from this past November that Jill and Beth hosted for a comprehensive review of COVID-19 benefit compliance considerations, and that highlights both ongoing and considerations that are almost over. But for purposes of Jill's question in our chat today, I'm going to give a high-level overview of those end-of-year requirements that employers should be aware of. First, filing those tax credits for the FFCRA. Now, as you may recall, paid leave was optional for 2021, and that came about if the employer chose to provide such leave. Employees would be eligible if they had COVID-19, experienced symptoms, sought medical advice, testing for COVID-19, vaccination of COVID-19, or side effects from the vaccination, or an employee to take care of a family member for those reasons, or a quarantine order. Now, the leave period ended September 30, 2021. However, what employers should be aware of as the year wraps up is that they have until December 31 of this year to claim the tax credit for any leave provided in the third quarter. So next, similar issue, it's time to claim tax credit for ARPA COBRA premium subsidies, and that's specific to any subsidies provided in Q3. Now, as a reminder, the subsidy was provided from April 1 to September 30 of this year for assistance eligible individuals. Now, while the subsidies ended September 30, as I mentioned, employers will have until December 31 to claim the tax credit that may apply to the third quarter. Another action item employers should be thinking about is amending their Section 125 plan. Now, this will come into play if employers chose to permit any of the optional reliefs. For example, mid-year election change relief for health FSAs or dependent care FSAs, or Section 125 election changes, and that would be without a qualifying event. So if an employer chose to allow for some of that relief, plan amendments will need to be made. Now, if relief was made for plan year 2020, plans need to be amended by the end of this year, December 31st, 2021. However, if relief was implemented for 2021, the plan will need to be amended by next year, 12/31/2022. Another thing employers need to be aware of is telehealth and HSA eligibility. As a side note, in order to be HSA eligible, there's several different requirements, but one is that you can't have first dollar coverage or coverage that pays before the required deductible is met. Now, the CARES Act allowed for a high deductible health plan to cover telehealth services before the statutory deductible is met. And this relief was not limited to COVID-19 related telehealth visits. This was very welcomed relief, right? So the result here is that high deductible health plan participants are able to remain HSA eligible, even though they might receive medical care before meeting the statutory deductible through telehealth. However, this relief was only available for plan years beginning on or before December 31, 2021. What does that mean today? It means that calendar year plans will no longer be able to rely on this relief as of January 1, 2022. For those non-calendar year plans, they will only be able to rely on this relief through the end of their plan year that will end sometime in 2022. Now, we're not aware today of any legislation or regulatory announcements that this relief will be extended, but we're hopeful, and Chase might speak to that. Now, Jill, I believe this was a two-part question, so I'm going to switch my focus from end-of-year considerations to what's still going on. What's still going on, we have the extension of certain timeframes. So the agencies, and we mean the HHS, Department of Labor, and IRS, they require plans to disregard the outbreak period, and that's from March 1, 2020, until 60 days following the end of a national emergency, and that's for certain deadlines. So during this outbreak period, those deadlines that are told include COBRA, premium payments and elections, HIPAA special enrollment rights, claims filing and appeals, and external review. Now, the outbreak period is still going on and will go on until 60 days after the end of the national emergencies. And as you may recall, we received guidance earlier this year that explains that this extension of timeframes will continue until the earlier of 1 year from the date the individual or plan was first eligible for relief, or 60 days after the announced end of the national emergency. So what does this mean? Today, it means that in practical application, I think HIPAA special enrollment rights are likely the most common issue for employer plan sponsors to remember. So until the end of the outbreak period, anyone who experiences a HIPAA special enrollment right in the last 13 months can come and enroll in coverage. And sometimes that's hard to remember when we're in our standard operating procedures. Now, keep in mind that not all qualifying events are HIPAA special enrollment rights. So marriage, birth, adoption, placement for adoption, loss of coverage, loss of Medicaid, or gaining premium assistance from Medicaid or CHIP, those are HIPAA special enrollment rights. And HIPAA special enrollment rights are also requests to enroll in coverage. So while somebody might experience a marriage and might request to drop coverage to be added in the spouse's plan, that is not a HIPAA special enrollment right. So just keep that in mind. It's not all qualifying life events. And then its ongoing COBRA obligations should be addressed by your COBRA vendor as this continues to impact COBRA elections and payments. Another thing to keep in mind before I wrap this up is that some of the relief permitted were health FSA extended grace periods and carryover provisions. So more specifically, DCAPs and health FSAs were able to provide a grace period of up to 12 months and a carryover of up to any unused amounts into the subsequent year. And that was for 2020 and 2021 only. But here, as we're looking into 2022, you have to keep in mind that an extended grace period or carryover provision will impact HSA eligibility into the subsequent year. Now, there are ways to preserve HSA eligibility, and we're not going to take a deep dive into that for purposes of today's conversation, but if you have additional questions on how to preserve that HSA eligibility, certainly reach out to your consultant and we can address it. But just a word of advice and caution that keep in mind that the relief extended into 2022 could impact an individual's HSA eligibility. And then lastly, for calendar year 2021, there was an increased DCAP exclusion for $10,500, generally $5,000. So let's say DCAP offered an extended grace period or carryover, even if the employee is, I think some good advice to remember for this coming plan year is that if an employee is reimbursed more than $5,000 in 2022, the good news is that the IRS did clarify that because that is due to the extended grace period or carryover, that the IRS has provided relief that the excess will not be taxable because the limit is temporary based on when they were contributed, not reimbursed. So just a final plug that our Get Wise Wednesday from last month, we'll go over this in detail, and also our optional versus mandatory publication.
Thanks, Diane. You had a lot. And there was a good question you can read in the chat that went out. I think that went out to everybody. Let me make sure. Yes, everyone. So look at that for clarification on the HSA and telehealth eligibility. And I want to point out one thing that Diane said about the qualifying events. Yes, we're so used to saying employee comes to us and says, hey, I had a baby 6 months ago. Hey, I got married last year. And we say, no, you're out of time. But these have the extension that she talked about. I had a very close case that came last week and they were down to counting days. Somebody had gotten married last September, came in early November and wanted to know if they could add their spouse. We were down to adding days of when they were married, plus the normal 30 days, plus the 1 year extension. So don't automatically say no. Okay. Thank you. Okay. Chase Cannon, fearless leader, Chase Cannon. You have the reconciliation bill, which is easier to say than the Build Back Better Act. So before I turn it over to Chase, I want to say a tidbit about him is that he is especially skillful with tax because he has a specialized tax degree I'm not sure how that applies. Like he has the law degree and then there's a special part that he did extra school for just for tax, and he worked for the IRS as well. Good with non-discrimination too. But other than being bad grammar, Chase, with the Build Back Better Act, what can you tell us about us? What's the status?
Yeah, it's a bad acronym as well. You don't know how to say it. I mean, some of these other acronyms like COBRA, some of them flow off the tongue. Ba. I don't know how that quite works, how you say it. Triple BA, I don't know. So whatever it ends up being is still up in the air. You just don't know. And so kind of the short version here is the BBBA is sort of the Democrats' key social and economic priorities overall. And the House already passed their version of it, but the Senate is where it is now. And there's a couple of different versions within the Senate. And so one thing the Senate is trying to do is pass it through the reconciliation process, which means that the parts in the law have to be related to the budget. And so there has to be this tie to the budget, this impact to the budget. And that is another term you'll hear is called the Byrd rule. And that's BYRD. It's not Larry Bird. It's not Big Bird or any other birds you might know. It's BYRD. And that's named after Robert Byrd, who was a senator and kind of put in these guidelines when you're doing a bill through reconciliation that say it basically has to be tied to the budget, and it can't just be something that is a policy that will have a policy effect, and it has to have a small increase on the deficit outside of the 10-year budget window. So why does that all matter? This is kind of how it gets bogged down in the Senate, is that the committees have their versions of the bill, and then it has to go through this reconciliation process. Actually call it the bird bath. Again, it's not necessarily a bird bath, but a bird bath is the process where you go through, and the parliamentarian is another term you heard. We're doing all the terms today. Parliamentarian sounds like the big scary person in there, but the parliamentarian is kind of the ruler on whether certain provisions in the law actually do relate to the budget. And then the parliamentarian either strikes out part of the law and it can't be part of the process, or they allow them to stay. And the reason that all matters is because if you can pass it through this reconciliation process, you only have to have a simple majority in the Senate. And so we've seen this used on both sides of the aisle to get laws through. COBRA went through actually way back when. The part of the ACA, the Tax Cut and Jobs Act of 2017. So the big tax cuts back in 2017. ARPA last year went through this process. So it's a common process used by both parties to try and get it through. Bottom line is there's going to be some finagling here in the Senate. So we don't know exactly what will be in here, but 3 things to keep an eye on: the ACA affordability percentage for employers and for individuals could go down to 8.5%. So that is how we measure affordability when we're looking at employer-sponsored coverage. That could impact employers when it comes to setting premium rates, right? Instead of going off the normal 9.5% that's kind of been indexed over the years, and we would go back to 8.5%. That also would impact eligibility for a premium tax credit in the exchange. So that's one thing to watch. Another is monetary penalties under those MAPIA provisions that Beth explained so well, and that we have several other resources on. So having a little bit stricter enforcement on those and some higher penalties. But the biggest thing to watch is with universal paid family and medical leave. And this is the one that could really throw a wrench into things if you're thinking about from employer compliance, just because it could be a lot more interaction, a lot more review of employer policies. And the biggest thing is interaction with state laws, because a lot of states already have these paid family and medical leave laws out there. And this would maybe, depending on how it comes out, could either conflict with or provide, you'd have to feel out how that interaction works. But basically the current version says 4 weeks of paid leave administered by the federal government. The original version had that at 12 weeks.
Yeah.
So you already see kind of the whittling down of things. The benefits would be excluded from gross income. That's something that's different. But basically employers that had the same or better paid leave benefits would get governmental reimbursements. States that provide same or better paid leave benefits would receive federal grants. And it would be for qualifying leave events such as the birth and adoption of a child and the serious health condition of an employee or their family member. Family member is pretty broad, similar to these state laws we've seen with it, including a child and a spouse. It also includes a registered domestic partner or someone in a civil union, a sibling, grandparents, and in-laws. So pretty broad there. So what to expect there? Senator Joe Manchin is really the one to watch here. He's been dragging his feet, particularly on the paid leave part of this. And so he, again, you're thinking about the simple majority in the Senate, that makes him a pretty important person when it comes to getting this through. So we'll just have to see. Again, the big thing, the employer takeaway here is to pay attention, watch, and just see what happens. We'll cover this and make sure it gets out there, and then reviewing leave policies. So back to you. I know we're short on time and we have a few more things.
Thanks, Chase. I want to say the original version would have helped all of you that have a national presence, especially in this post-pandemic remote world. The original version had a structure that would have limited really new states coming up with their own version, and you're juggling 50 different versions of state leave laws. This may not survive and it would not help you. But I think there's a special reward for someone who takes leave to care for an in-law. I think there's a special reward for that person. Okay, Beth. Beth is our double dipper because she has many talents. And you basically have 2 minutes to tell us what's new in the retirement world. And I'm sorry, we focus on health usually in these discussions, and now we've slighted your retirement skills again.
We do. Retirement is kind of the redheaded stepchild of benefits compliance as we do it. Sorry, Jill. But I will say that retirement has also been a little bit less volatile and ridiculous than health and welfare has the last couple of years. We did get some COVID relief early back in like March of 2020 that has since been over. So the increased amounts on loans and hardships if you had a COVID situation were kind of came and went in 2020. So we're not really dealing with a lot of the COVID changes like the health and welfare plans are still potentially dealing with. However, we did back in 2019, which I still think of 2019 as last year, and it's not, right? Like we all had this like 1.5 year bubble of COVID. But back at the end of 2019, we had the Secure Act passed. And that was like the biggest piece of retirement legislation that we had seen in about 15 years. It made a number of changes. There's like a hodgepodge of them. We've done a few articles. We did a presentation, I think Carol Wood and I, on that stuff. But now we're at the point where like Secure Act 2.0 stuff is popular right now, and we might see legislation on that. And so really, you know, the Secure Act was focused on making sure that more people had access to retirement plans, making sure that those who did have a retirement plan are saving enough for their whole retirement, and then also kind of looking down the line and making sure that what they do inevitably save is enough to get them through the rest of their life. And so what we're seeing now with potential Secure Act 2.0 is just kind of some of the same stuff that happened with Secure Act 1.0, if you will, but they're kind of extending it, right? So they're doing things like requiring plans to implement auto enrollment to get more people involved. There's some cool things like student loan payments being treated as an elective deferral for matching, which is kind of cool. They're going to increase the required minimum distribution age potentially from 72 to 75. And so really it's just kind of a number of changes that just follows along with that same path that Secure Act 1.0 went down. And there's bipartisan support for this. So we could potentially see this come through with the Build Back Better, whatever that's going to be called. But we'll have to wait and see. So that's retirement.
Thank you. That was very fast. Thank you. So finally, no explanation, no title only. What is your favorite holiday movie? Patrick.
The Man Who Came to Dinner.
Carol.
Classic Miracle on 34th Street.
Diane.
Elf.
Yoko.
Home Alone.
Beth.
Die Hard. Debate there.
And I can't debate. Okay, Chase.
Christmas Vacation.
Amber.
Ooh, I think I'd have to say Elf.
Me
too. Yeah.
Okay. I'm going Elf. I'm going with that one. Amber, I will turn it back to you. And a tidbit about Amber is that she came to us as a temporary intern, and we liked her so much, a position became vacant, and so she has stayed with us. A little birdie also told me that if someone were choking or having a cardiac event, you might have some special skills to help them out and save their life.
I do. I am first aid and CPR certified.
Thanks, Amber. Thanks for all you do for us.
And not to interrupt Amber, but did we say a tidbit on Jill that maybe she's celebrating her 15th year at NSP this week?
Thank you. Yes.
So, yep.
Thank you. I love it here. Happy holidays to everyone, and can't wait to work with all of you in the new year. And Amber, take us out.
Thank you, everyone, for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We will be sharing the recordings in the follow-up email. If there are any portions of this call that you missed, by Friday, you will receive an email with a link to the full recording. The PowerPoint slides shared during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete this survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today and the last one of the year. Thank you, everyone, for joining us, and have a great day.